In the first section of our lecture, Assessment of Fetal Wellbeing, we will talk about the uses of ultrasound. So in this section, we will talk about what's the diagnostic value of ultrasound in obstetrics. We will talk about the transvaginal ultrasonography, and also we will talk about the Doppler ultrasound. So ultrasound is the principal imaging modality used in obstetrics. So it's very commonly performed procedure during the obstetrics or in the pregnancy. The importance of using ultrasound in obstetrics is it screen pregnancies. So screening of pregnancies is performed by ultrasound. Other very important function of ultrasound is dating the pregnancy. If the patient or the pregnant woman is not sure about the dates, usually the females who have irregular cycles or who have missed cycles, if they get pregnant, usually they are not sure about their dates. To find out the expected date of delivery, usually the dating in these cases is performed by ultrasound examination. So dating pregnancy is another very important function of ultrasound in obstetrics. Then they monitor the growth of the fetus or infant. Fetus is important because the growth, if it's not normal, if it's small for dates baby or if it's large for date baby, then it's different conditions can cause this and they can be managed. So to avoid any complications at birth and delivery. And then the other important use of ultrasound in obstetrics is to identify any congenital abnormalities. If there are any congenital abnormalities, if they are found at early time, if it's the choice of the parents, if they want to keep the pregnancy, if they want to abort, or if they don't want to keep that pregnancy, it's all give them the options. So it's the lot of functions are performed by the ultrasound during in obstetrics. Date pregnancy, monitor growth, identify congenital abnormalities. Other advantage of ultrasound is it is non-invasive procedure, it's safe, and it's cost-effective investigation. It's easily available in lot of clinical practices, hospitals. Nowadays, it's available. So this test is easily available and it's very cost effective, not very expensive also. So every patient is easily afford this test. Even though it's easily available and cost effective, but it should be performed as limited as possible. Only when it's really indicated, then it should be performed. This is the picture. This is the ultrasound. That's how it looks like. This is the monitor. We have the keyboard, and then we have this is the transducers. With the help of the transducer, jelly is applied to the transducer to transfer the waves easily, and then that's how it is performed. And then you see the picture on the monitor or the screen. Diagnostic ultrasound in obstetric practice, the transducers are usually, this is the abdominal ultrasound probe, and this is the transducer. We have two types, usually flat, or it can be curved linear probe. So two types are the transducers or probes are available. ultrasound. This is the bigger ultrasound probe, and this is the picture achieved after the abdominal ultrasound, and the frequency is of this probe is from 3.5 to 7 megahertz. So frequency of the probes is 7.5 to 7 megahertz. They can be flat or curvy linear. This is the transvaginal ultrasound, or this is the transvaginal transducer or probe. It is long, thin as compared to abdominal, so it can be easily inserted into the vagina and directly. Usually it is used in late pregnancy. Transvaginal ultrasonography is performed to examine the cervix and the location of placenta. If patient comes with bleeding and pain, usually if the placenta is low-lying, then it should be diagnosed before labor and delivery, because low-lying placenta is the indication for C-section. So if the patient has low-lying placenta, usually they should go for C-sections. So it's very, very important that diagnosis should be made late in the pregnancy about the position or location of the placenta. If normal vaginal delivery is tried in these females, usually they can lead to serious hemorrhages and loss of the baby. So it's important to examine the cervix and lower edge of the placenta. In early pregnancy, why we need to perform transvaginal ultrasonography if there is incomplete or missed miscarriage, or if there is blighted ovum where no fetus is present. So early, when the uterus is small, early pregnancy, when the fetus is not developed or grown, if there is any bleeding, if the female comes with the bleeding per vaginum, then vaginal ultrasound is performed to find out if the pregnancy is viable. If fetal heartbeat is present in the early pregnancy, it means pregnancy is viable. If it's in the uterus, it means it's the uterine pregnancy, not ectopic pregnancy. And the other thing which is common in early pregnancy, if it might be not a normal pregnancy, if it's blighted ovum in which no fetal heart develops, the sac is present, and usually once the blighted ovum is confirmed with vaginal ultrasound, then patients usually or females usually abort, or they have a miscarriage in the first trimester after a few weeks. So all this can be diagnosed with transvaginal ultrasonography. It has indications both in late pregnancy and early pregnancy. Acoustic impedance. Acoustic impedance is the resistance offered by the tissue to the waves which can give the picture or form the picture. So this is the transvaginal ultrasonography inserted into the vagina. This is the uterus, ovaries, cervix. Very, very helpful to diagnose lower lying placentas, blighted ovum, abortions, incomplete or missed miscarriages. Then the other type of ultrasound is Doppler ultrasound. Doppler ultrasounds are performed for the assessment of velocity of blood. within fetal and placental vessels and provide indirect assessment of fetal and placental condition. So Doppler ultrasounds are for the examination of blood flow in the blood vessels, fetal or placental. And this gives the idea if the blood flow is good, if there is no hypoxia, no asphyxia, then it means the baby's condition is good, and because the blood flow is adequate and good. So that's why we perform the Doppler ultrasound. This is the picture obtained by the Doppler ultrasound that gives the picture of the blood flow. It can be color and spectral Doppler. It interrogates uterine, placental and fetal blood vessels and provide information on uteroplacental function and fetal well-being. So if blood flow is good in the blood vessels, it means the blood flow to the fetus is enough, good, so the condition is good. So it's a very, very good test for the assessment of fetal well-being. In cardiotocograph, CTG, cardiotocograph provide continuous tracing of fetal heart rate, pattern of which alter when the fetus is hypoxic. So this you can see is the tracing of fetal heart rate, blood flow, and if the patient has hypoxia or decreased blood flow through the placental and fetal blood vessels, then this tracing is affected, pattern is affected. This is the baseline. Next is an ultrasound and invasive procedure. Besides the use of ultrasound for diagnosing different conditions and different abnormalities, the other very important use of ultrasound is during invasive procedures. Ultrasound is performed to avoid any complications. So it helps us to guide when procedures are performed like amniocentesis, chorion villus sampling, in which sample is removed from chorionic villi, and also cardiocentesis and some therapeutic procedures. So ultrasound is performed for invasive procedures, during invasive procedures, and also for therapeutic procedures. Therapeutic procedures can be like different conditions like during pregnancy, alloimmune thrombocytopenia. Sometimes platelets are transfused into the fetal blood to protect against blood loss, and same during amniocentesis. It's the procedure in which amniotic fluid is removed from the amniotic sac. So all these procedures, if you cannot use the ultrasound and perform is blindly, there are chances that you might damage the fetus, or you might damage the some cords or other structures. So it's very important that these procedures should be performed under ultrasound guidance. Then we also have 3D and 4D ultrasounds available as compared to routine 2D ultrasounds. 3D ultrasound give a more clear picture, more clear visualization of the baby, and this is more close to the real picture what the baby will look like. But besides that, the structures like fetal spine and corpus callosum, which is the structure that combine the two cortices. Inside that, only the 3D and 4D ultrasounds can be used to rule out any abnormalities in the spine and corpus callosum. So in females who have high-risk pregnancies, who have a history of previous loss of pregnancy, usually 4D, 3D ultrasound are indicated at least once in the pregnancy. So 3D and 4D ultrasounds are also available. So that was all about the ultrasound and why they are and what are the indications of ultrasound in obstetrics. Thank you for watching sqadia.com.